I want to thank you all for joining us today on the ABIN monthly webinar. And if you don't mind, if you could put your um, maybe your name and the organization you're with in the chat, that would be awesome. And we're going to go ahead and get started in just a moment. One of the things that I like to do is I like to remind everyone that we are recording these monthly webinars, and so you are being recorded today. And by staying on today's webinar, you are giving us your permission to be recorded. We will post this to the ABIN website where we have a webinar library, and um, these webinars will be there so you can go back and view. And one of the things that we hear from people, they might have a topic they're interested in and they'll go back and view these. We'll also upload the slides. So please know that is happening. Um, and we appreciate you staying on. Please don't hesitate to ask questions. We want this to be interactive. And so oftentimes we have different guest speakers, and sometimes they're on different topics, but we do an annual webinar now. Every year we've done this. This is our fourth year where we highlight the MSW students who are working in integrated behavioral health practices. And I think it's really an opportunity for them to share their experiences as well as for you all to hear what it's like to be inside a primary care practice that has integrated behavioral health. So with that, we'll see if Jenny has the slides at a point where we can move forward.
There we go. Is it Sharon?
Yeah.
Yes, it's in the presenter mode. I think if you,
Mhm.
yeah, go to slideshow and play from
There we
beginning.
go.
There you go. Awesome.
All right.
Perfect.
Oops. Uh-oh. Uh-oh. Is it showing the entire
Uh-huh.
the notes or the regular?
Nope, just the regular slide.
Excellent.
Perfect. All right. So with that, if you can move to the next slide, we're going to go ahead and we're going to talk to you a little bit about what is integrated behavioral health. And so integrated behavioral health, it's a whole person care model where we're addressing under one umbrella mental health conditions in physical health settings. And when we say behavioral health, we mean mental health, substance use, and health behaviors and health behaviors that could be impacting current health conditions. There are a lot of different terms for integrated behavioral health. You'll hear us refer to this as BHI or behavioral health integration. You might hear things such as integrated care, collaborative care, primary care behavioral health. But no matter what we call it, our goal is the same, which is better care and health for the whole person. Next slide. And so the next slide, we have a continuum. There are 6 levels of integration that SAMHSA has come up with and supported. And these are everything from coordinated care to full collaboration. And I think it's important because as we're starting to talk about integrated care and integrated care models, one of the things that we often hear sometimes is, we've started to try this and it really doesn't work. And it could be that we don't have all of the components for a fully integrated model. And so when we think about coordinated care, oftentimes it is some type of relationship with what primary care has a relationship with a specialty care provider, and that care provider is sharing information but they are not sharing the same EMR and they're not located in the same site. We think about co-located, and co-located is when we do have a specialty mental health provider or mental health provider who is on the same site, but they're not sharing the same records. And what we've heard is even if someone's down the hall, it could be challenging um, to get patients to accept a referral and to keep those referrals. And then we see the last level, level six, which is full integration. And with full integration, we have a fully integrated model where we have a behavioral health consultant. In this case, we have our MSW students who are fully embedded in the team. They're working side by side along the primary care team. They're participating in daily huddles. They're documenting in the EMR. They're sharing information across the nurses station, and really working together to create a comprehensive treatment plan and make sure that patient's getting what they need. Next slide. Okay, so one of the things that we do, as we just talked about, there's a lot of different moving pieces with integrated behavioral health programs. And so when we first started talking to students, um, we started talking about this thing called behavioral health integration. And there really hasn't been a lot of opportunity for training yet on in academia on integrated behavioral health. And so one of the things that we did is we created a 2-day boot camp. And so we invite the students to attend this 2-day boot camp. They come, they join us for 2 days, and they learn the nuts and bolts of behavioral health integration. And we equip them with skills that they then take and grow into their internship. Um, for me, it's one of the most exciting parts of my summer, getting to see a new group of students, getting to see their enthusiasm, excitement, they're eager to learn. And so we talk to them about what is BHI? What are different models of BHI? What will you be doing? We talk to them about the importance of screening and universal screening and assessment. I see them smiling. Brief interventions. When we first talk about this could be, this might just be a 15-minute visit, or, this is going to be a short visit, a 30-minute visit. Wow, what am I going to do in that 30-minute visit? And so we really spend a lot of time equipping them so they feel comfortable meeting patients where they are and providing those brief interventions. We also spend a lot of time on suicide assessment. We want to make sure we're screening, we're properly assessing, and we're making referrals when those are needed. And then well, we've had psychopharmacology with Dr. Gibson, who's done a fantastic job talking about psychiatric medications that they might hear about when they're in their internships. So lots of exciting, fun things that are happening. Next slide. And with that, okay, and you could see here are some of our classes of students. We're really excited. And we have a variety of different placements. This year we have 4 participating clinics. And help me out. Sometimes I forget under pressure, but we have River Valley, we have a Baptist clinic, we have North Hills, and we have the Christian clinic. So we're really excited. One of the things that we do is we create a match. And so we look at where are students located, what's their interest, and then do we have a clinic in that specific area? And we have a high emphasis on our rural areas because we're trying to make sure we're spreading these models to the rural parts of Arkansas as well. And with that, I think I'm turning it now over to Caitlin, and she's going to talk to you a little bit more about, next slide, about the supervision components and what all is involved with that.
Can you hear me okay?
Yes.
Great. Okay, because my computer's lagging a little bit, so just wanted to make sure. And if you don't know who I am, I'm Caitlin Johnson. My face is usually over all these things, so I expect a lot of people to know me. I'm popular. No, I'm kidding. But I provide a lot of the supervision for these students. And what's unique about our internship is that they are typically the only social worker on site. Now, it is different for one or two of our clinics, but typically our supervision is done virtually. So we meet with them. We have a strict meeting time every week. We meet for at least an hour. But the students are also encouraged to call us on the phone or text us, especially if there's a suicidal or homicidal ideation patient going on. You know, safety concerns, they are told to go through those things with us in real time, in live time. But that's one of the unique things is that we're able to equip these students with the education and training that they need enough to go out there and feel pretty confident to be there by themselves. And that in turn lets us extend to more rural areas because I don't have to necessarily be in the room, and Kim doesn't have to be in the clinic or the room in order to extend these services out there to our rural clinics. So we're very grateful for our students taking a leap of faith there and going into the clinics by themselves. So we have that weekly virtual supervision. We have on-site session audits. We often try. Now, my students are going to probably keep me honest. I have not been able to go out there and see them yet. But we typically go out there at least once or twice a semester to audit their sessions. So that means that I get to see how they're interacting with patients, how are their warm handoffs going, do I have any suggestions for their intervention style, etc. And then we also, as a part of this internship, the clinics that we place these students in have an opportunity for implementation assistance through Kim and I. Where we help them develop, or the MSW student helps them develop the program so it's sustainable once that student leaves. And hopefully we can place another student there. If not, they're still able to do some kind of integration as far as universal screening and knowing when to referral, etc. And then once they leave the boot camp, the 2-day boot camp, we also equip them with an online library that has been made with worksheets and information on chronic diseases and different things that students in the past have made as far as flyers and educational handouts and that. So we really try to give them as much as we can on the front end, but there's still so much interaction going on with them on an ongoing basis throughout the year. Next slide. Awesome. So we like to provide some of the statistics that we have for the previous year. So this is going to be the 24-25 MSW student data. As you can see, most of those patients that these students saw were English speaking, but we did have a chunk of them that were Spanish speaking. And then other could be Marshallese, etc. So some of those things that we don't typically see in the clinics. And then the biggest payer source that the students saw was private insurance. And now private insurance can mean that or Medicaid expansion. So that's going to be the insurances that are purchased through Medicaid dollars. Those are going to show as private insurances on this data. Then our second biggest was going to be Medicaid. And then Medicare, and then finally uninsured. We do have a couple of students that in the past have been placed in our very underserved areas and seen mostly underinsured or uninsured. And we do take we take that very seriously, trying to put students out in that area because we know that helps increase access to behavioral health as well. So next slide. So what are they seeing? They're seeing a variety of things. The biggest referral source is going to be a kind of a fight between your mood disorders and your chronic health conditions, and that's one of the things that we really try to educate these students on and let prospective students know that not only are you seeing your mental health disorders, but you're also seeing the chronic health conditions. So you'll see the depression and the anxiety and the grief and the things that come in that we would typically see in a mental health setting. But then you're also getting referrals for hypertension and weight loss and tobacco cessation, things that are behavior based, which most medicine is. So they're able to see a lot more patients than they would typically see in a traditional setting. And then there at the bottom, really specific, they are seeing a lot of anxiety, stress, and panic. which is not surprising to me, especially over the last couple of years, just as far as the housing crisis and the increase inflation and that we're seeing a lot more patients present with anxiety and just overall stress, needing to know how to manage those things on top of their chronic conditions. Next slide. All right, so I had these numbers pulled up because I knew I was not going to remember them. So as far as intervention efficacy, we want to make sure not only are they a resource there, they can provide education to the clinical staff, but are their interventions working, right? Like that's kind of what we need to know at the end of the day. So last year's students saw a lot of patients. I don't have the number in front of me, but after we tallied up all of the PHQ-9s, which is your patient health questionnaire, that's going to screen for depression. Their average score for the PHQ-9 average presenting score is about 11, and that's about moderate depression. And then when they would rescreen them, either towards the end of the episode of care or at the end of the episode of care, they usually averaged out at about a 7, which is a 33% decrease in depressive symptoms. And that was across the board for our students last year. And then you can see over on, or the next value there is our GAD-7. That's the generalized anxiety disorder screener that's going to pick up on anxiety symptoms. Their average presenting score was about 11 too. And then when they would re-screen them, they saw about a 29% decrease, averaging out at about 8 on the GAD-7. And I like to give a little bit of grace with the PHQ-9 and GAD-7 scores. They're pretty sensitive. So, a lot of us deal with the same symptoms that wouldn't necessarily qualify us for a diagnosis, but they're showing up on the screener, right? So I think any kind of a percentage of decrease is really significant, especially when their students, they're learning how to do this and they're able to make that big of a difference already. Next slide. Okay, I'm going to pass it back over to Kim. Dr. Martin and Tucker have been gracious enough to join us today to talk about the students that they have had currently and in the past. So I'm going to hand it back over to Kim so we can hear from them.
Awesome. Yes, I want to thank you both for being with us here this morning. I know you guys are really busy and it's a clinic day, but we're so grateful to be able to spotlight River Valley Medical Wellness. And we have to say this is the second year that they have hosted a student with us. And we want them to share what their experience has been like because I think that they have clinics and, well, I guess, Tucker, maybe you could tell us a little bit about River Valley and then we can move into asking you all some questions.
Sure. I'm happy to do that. My name is Tucker Martin, Chief Operating Officer at River Valley Medical Wellness. Dr. Kristen Martin is our owner and CEO. She's on the call on a busy clinic day. She and I are not related. We just very coincidentally share a last name. But Dr. Martin had a vision several years ago to kind of move the front lines of integrated care forward in the state of Arkansas. So we have a brick and mortar clinic in Russellville and another brick and mortar clinic in Hot Springs, Arkansas. And our commitment is to bring high quality, practical healthcare solutions into our rural population centers or hubs in rural areas. So integrated healthcare at our clinic involves 3 main service lines. Primary care, and that is exactly what you expect it to be. We have a very robust outpatient addiction care program we provide services for a variety of substance use disorder diagnoses. And then we have a continually growing behavioral health service line that includes therapy. We have 2 psych nurse practitioners for medication management, and we're able to address the concerns associated with a variety of behavioral health diagnoses from mild to moderate depression and anxiety, all the way up to things that inch very close to an SMI. Obviously, serious mental illness is a bit outside of our scope, but we have great outbound referral partners if we need to engage in a higher level of care. So this is as Kim described, this is our second full school year with an intern. I see Rebecca on the call, and everybody that's associated with. I just want to associated with this program. I want to say thank you very much. This has added tremendous value to what we're already doing in our clinics. And Dr. Martin can describe. I know you have some questions, but I do want to say that oftentimes facilitating a transition, especially for our primary care patients who come to us who have had bad experiences at other clinics. They just generally probably have a level of mistrust when it comes to healthcare because they don't feel like their voices are ever heard. And they often feel marginalized in these healthcare settings that are supposed to provide a safe and healthy environment. The behavioral health intern work that has happened with Renee, who is fantastic, our current intern and our previous intern, has helped us bridge the gap between our primary care service line and our behavioral health service line, and provided tremendous value, and we're really grateful for that.
Awesome. Thank you, Tucker. Thank you for that introduction to River Valley. I thought you could do it much more eloquently than I could. And Dr. Martin, thank you for joining today. We know you're really busy and it's a clinic day, but we wanted to ask you a couple of questions. And we know you have this vision, you've been growing this amazing clinic, and just wanted to ask you from your perspective, what motivated you to accept an MSW student who was trained in behavioral health integration?
Sure. Well, I think first of all, kind of what you all have touched on. For me, I look at when we're taking care of people. I think it's so important to understand how physical health, mental health, all integrates together. Looking at the whole person, recognizing that sometimes people's mental health conditions exhibit physical symptoms, and sometimes people are there's a lot of those different things that we take care of day to day in the clinics that really can benefit so much from having somebody meet with them about mental health concerns. I just last night spent with somebody talking about sleep disturbances and insomnia, and they were talking about all the years that they had been treated with certain medications, and we kind of got to break it down more about anxiety, depression, PTSD, really be able to look at that. And not every day with the primary care hat do we always feel like we have the time to spend with people to really kind of dig a little deeper or be able to provide education and resources and some kind of follow-up, the same way that I think having mental health providers and having an intern can really sit and help dig deeper, help provide people support, have it be from somebody that's not just the physician talking. And so I think it's been fantastic to be able to not only have that extra support, but also gain knowledge on techniques that I may not have been taught in med school, or I may not have ever seen before, or perspective heard, that I think having the interns be able to share with me ways that I might be able to better effectuate care is such an important part of just that whole team process. So there's lots of reasons that I love taking them, but I've had wonderful interns. So I could go on all day, Kim. You know I can.
No, no, we are so happy that you've had positive experiences. One
Yeah.
of the things that because as you know, we are recruiting different primary care sites and we're talking to primary care sites about benefits of having a student. One of the things that sometimes we hear from primary care clinics is, gosh, I don't know that I have the time to take on a student. I think it's really going to affect my workflow. I don't know that I'm going to be able to um, have a student here because I think it's going to slow me down. I don't know if you could
Okay.
talk at all um, about what your experience
Yes.
has
Yes, I
been with that.
Sure. No, absolutely. And I think as somebody I've trained student, we take on students and train students all the way from nursing students to we have the residency send people here now to gain addiction medicine rotations. So we have a continuum, and there is a difference. I think. I think with the interns that we've had, due to the way that you all help support them and educate them and do that really it's a complement to what we're doing and does not take me extra time where sometimes if I have medical students or residents it may take me more time to sit and explain and watch them see a patient and kind of it's a little bit different setting to what we typically think as far as medical students and so I have found it has allowed me to really gain benefits with patients and has shortened my time that it's made it more effective and actually because I can take somebody, I'll use an example diabetes, although I know Renee will say that Dr. Martin sees everybody ADHD, but I have a lot of those too. But take somebody that's diabetic who's non-compliant. There's a lot of staff time or a lot of time I might spend as a physician trying to go through that whenever I can introduce them to Renee, say, hey, can we talk about this and kind of see if we can get to the root of this issue or some motivational interviewing and things. And she's able to take time off my plate that I can work at my highest level because she's able to work with them more and do some problem solving and motivational interviewing or maybe compliance for medications or something like that that is wonderful.
No, no, that's awesome. And I think it's so helpful to hear from someone who has a student, has this busy schedule, and to hear that it has really been helpful and it's actually shortened some time. And that if there are times you're like, gosh, I'd like a little more information on this, or I'd like someone to explore a little further, you have Renee who can do that and then bring that information. So
Sure.
that's all to you. That's awesome.
I think the other thing that I always want people to know, and I love it when my patients say this, is that as a physician, so often we get used to people thinking that medicines are going to fix everything, but don't do the other behavior modifications. And so I think the benefit that I've seen with both years of interns is that whenever they get some of that training and expertise and learn more about their ADHD or learn more about anxiety coping mechanisms or some benefits of sleep, different insomnia uh, techniques or information, that when my patients come back to me and say, I hate to tell you this, but I think what your intern taught me works better than the medicine. I say, fantastic because that's what we really want is people engaged in their processes, right? And to learn that medicines don't necessarily fix everything. When the physician tells you that sometimes of, hey, I need you to not drink caffeine or not do these different things, it doesn't always resound the same, I think, as when somebody has the time to work through the process with them and kind of do that. And again, doing motivational energy, interviewing, setting some goals, whatever, techniques is important for that patient. And I think that's where we really get the results and exactly what we want as medical providers. We just often feel limited on time or sometimes are not as effective in expressing that to patients as what the interns have been. So,
No, that's awesome. And I think for me that really speaks to this team-based model of care, right? And every person on the team is working together and contributing to get that whole person care. Um, so I know you're really busy, but I think for me, I have one more question, which is, um, from your perspective as a primary care provider, what skills, specific skills, stand out for you in students that are trained in behavioral health integration? And what are you wanting to see as students come to your clinic?
So I think one of the things that is been really helpful is that having people have a great understanding of different um, behaviors or screening exams. But while my clinic screens everybody for Guide 7 and PHQ-9 every new packet, right? Still being able to have somebody who can follow up on that or maybe identify. I've had each of the interns come and say, do you realize this person is actually suicidal? Like, and being able to kind of follow up on that, that maybe the patient wasn't willing to share or I didn't ask the right questions. I feel like that having that greater understanding of some of the behavioral health conditions and how those integrate into some of our other medical issues has been really helpful. Um, I love it that that they have been able to understand how to work in kind of short periods of time with patients who maybe have been unwilling to engage in therapy or things like that. But if it's very non-confrontational with patients. It's short episodes and being able to make them feel engaged, and it takes down that stigma of mental health or how behavioral health can work. Um, and oftentimes, once they have some of those interactions, then patients are more willing to follow up and they say, you know what, I think I do need some more help with this. I think it's okay for me to feel anxious and maybe get some more therapy or do some more of these sessions. And so I think um, by being able to destigmatize conversations and have open um, attitudes, particularly where we deal with a lot of substance use disorders and co-occurrence, then that has been um, key. I know that doesn't like a checklist of what
No, no,
you send me
that's
such wonderfully trained people. I already know they're going to be wonderful. So,
all. Thank you for that, Dr. Martin. We appreciate that. We try to lay the foundation and get them ready because we know you're fast paced and busy, and we hear they're seeing a lot of exciting situations and cases that they might not even have imagined. But we're going to hear from them in a minute.
yeah.
Um, all right. And Tucker, I don't know if you would like to add anything about what has it been like having this intern at River Valley? Anything you think would be important that you'd want to share when clinic
Well,
might be considering a student?
um, so two things. We'll start with the results first. Um, um, every single patient that we track that our behavioral health intern here at Russellville, Renee, has interactions with, we can almost put a pin in the graph and say this is when Renee began because we can see compliance with the treatment plan increase. We can see marked improvements in patient outcomes. This is really beneficial in a very, very, very practical way. Um, uh, the other real tangible benefit for patients is it extends the clinical experience beyond the day that they're there for the appointment because our behavioral health intern we let her run her own schedule. We give her full access to the EMR as a clinician in that capacity, and we can schedule follow-up telehealth appointments because in rural settings, transportation is the number one obstacle or barrier that we often have to overcome with engagement in healthcare services, especially specialty care, right? Um, so practical, tangible, and almost immediate, certainly very visible and obvious improvements, right? Um, when it comes to the day to day, I'm not a medical provider. I'm a business operator. Uh, uh, the students that you have sent us are so well prepared that they integrate very well and immediately into our teams, right? Uh, uh, we know that they're coming in um, with the support required uh, to really make that experience work for for both the student and the organization. So hats off to Caitlin, Kim, your involvement, and everybody at ABIN, um, knowing that they have the I'll call it technical assistance, the training, the supervision, um, has been able to give us really tremendous confidence in both of our interns. And we're very, very pleased and look forward to hopefully next year another one.
Well, awesome. We appreciate that, and we just have to say we're so thankful for River Valley. From the beginning, River Valley has really been open. And when we first started talking to them about what this was going to be like and what we were wanting to do, you guys were 100% on board. And Dr. Martin, you're a visionary and innovative and doing exciting new things all across the state, and you as well, Tucker. And so we appreciate you all so much for hosting a student. And so now that we've heard from you all and what it's been like on the clinic end, we're going to talk to our students, and we're going to give our students an opportunity to share what is it really like to work in this BHI model and to work in this fast-paced setting where we have brief interventions and we don't know what's coming in every day. And it's really a lot different than how our formal training has been. So with that, I'm going to turn it over to Caitlin and the students.
Thank you. Yeah, and I just want to give an extra shout out to River Valley because half of the success of this program is having, staff and providers that are willing to collaborate with us and have discussion with us on how to structure and what you need from a student and that. So that it has been a huge, huge plus on working with River Valley. So we really appreciate you guys, but you hear that from me all the time. Okay, so Jenny, you're welcome to stop sharing for right now, so we can kind of see all the students at one time, if you're okay with that. But I'm going to go ahead and let our students introduce themselves. I did not tell them they were going to have to do this, but I'm imagining that they will be just as good as anything else that they're doing. So I'm going to go ahead and start with Renee because she's in the middle of my screen. We've been talking about her. Renee, if you want to go ahead and introduce yourself, and then you guys are welcome to go on after her.
Yeah, of course. So my name is Renee. Again, I intern at River Valley Medical Wellness, which has been an amazing delight. I've learned so much, and the team has just been so helpful with just really everything. So I have over 1 year of experience in the inpatient behavioral health setting, and then I have about 4 years of experience in an outpatient mental health, as a customer service representative. But overall, over 5 years of experience in mental health. So I definitely like this setting. I think a little bit more than both of them, I'll be honest, because it's very interesting to be able to see the integrated, like being able to see the physical health, the substance use, and then the mental health, like all combined. It's just been really, really great experience, is all I can really say.
Awesome. Thank you, Renee. I appreciate it. Gabrielle, and I can't remember, do you go by Gabby or do you go by Gabrielle?
Either or. I prefer
Either or.
Gabby.
Okay, my friend Gabby, do you mind sharing where you're at and what you're doing?
Good morning, everyone. My name is Gabrielle or Gabby. I am currently at the Baptist Family Medicine Residency Clinic in North Little Rock, and I am new to mental health. And let's just say I have witnessed quite a few things so far. However, I've received great feedback from my clients and I have a steady caseload. So I'm really happy about that. I'm very happy about that. But again, I'm new to mental health and I'm really loving my internship. I've transferred from Little Rock School District to mental health. So I think this is where I'd like to stay.
Well, we're glad to have you. Thanks
Thank
for
you.
taking the leap of faith with us. And shout out to Chris Rule and Kat Roberts, who was one of our
Yes.
previous students a couple of years ago. They have been mentoring our friend Gabby over there, so we
Yes.
really appreciate
And
that.
they're awesome. So thank you.
Yes, we love them. Misty, do you want to share where you're at?
Sure. My name is Misty, and I am representing rural Arkansas up north. I am in Baxter County, and I am at the Mountain Home Christian Clinic, which is amazing. And we are a clinic that only see the uninsured. So it kind of takes me back to my community mental health clinic days. Like these people are my heart. I love this population, so I've really enjoyed it. They are completely new to BHI, so it has been a journey, but nonetheless, it's been a great time. So I've enjoyed it.
And I
Awesome.
have to give a shout out. You know, when Misty said, I'm really interested in volunteering at the Christian clinic, she's had some opportunities to talk to them. They were interested in behavioral health integration. She has had to, we've provided some support and education, but she's really been on the ground modeling and bringing BHI information to them. And we know that first year is a transformation journey, right? It's what is BHI and how do we do this? So shout out to Misty with helping with all those structural pieces.
Mhm.
Mm.
And then it shows Jennifer on her screen, but she goes by Kathleen. Do you want to share where you're at?
Yes, again, my name is Kathleen. I am at the North Hills Family Clinic here in North Little Rock. And I have had a year of private clinic. I've had a year of just being in a hospital setting. And so being here at North Hills, I feel definitely more well-rounded for it. It's been a fabulous opportunity. They're well adapted to the model of integration behavioral health. They've been doing it for a few years now. So it's been great just to kind of step in to a place that they already have their footing, and then where I can just kind of go with it. And it's been wonderful just to learn from them and just see all the different patients that we see. It's been great.
Awesome. And I have to say thank you too to Erica, who's one of our previous students. She's at North Hills and she has been a godsend helping me with supervision with Kathleen. And so I think Kathleen's got a great supervision team between me, Kim, and Erica, and she's got a whole lot of resources. So we appreciate her, Erica, for helping us out on that as well. Okay, we've got a little bit of time left, so let's jump into the questions. And just like I said in our email, not everybody has to answer them. So just one or two people sharing their thoughts, and then we'll keep going. So when you think about your experience integrating into a primary care clinic, has your perspective changed how we treat mental health, or has it been different than what you expected? Can you share a little bit on
So, as Dr. Martin had kind of said earlier, a lot of people don't realize the connection between mental health and like physical health. And so there's a lot of the times where people are like, I'm in a lot of pain. I feel like it's just gotten worse. And there's many times again like they're like, I want to have this medication, I want to try another medication to make this feel better, but in reality it's because of like all the stress and like all the anxiety and like depression and everything else that's going on, kind of like making their chronic pain worse. And so that's been something that's been very interesting to me, is being able to kind of step in and be like, uh, here's the connection. Like there's a very clear connection between the two. And so that's kind of something that I've observed more as I've been in this setting.
Good point. Thanks, Renee.
Just to add on to what Renee was saying, just knowing, that our systems are siloed, but when you get into primary care and just see really how siloed they are, and it's like, like, oh, not it. With anything mental health or behavioral health that comes up, they're just not equipped, right? So that's eye-opening to me.
For sure. So it sounds like education is a huge part of this role, not just for the patients, but also in some of these clinics that have never had an integration model or have never had an MSW student there or a social worker there. It sounds like a lot of education is a part of what they expect out of you and what your opportunities are. Um, I know, thinking back to my own grad school experience, which I promise was not that long ago, although every time I say the year, it scares me. But thinking back to my education, I know that we weren't necessarily trained in the medical model, right? In fact, they had some opinions on the medical model. So I would love to know how you all felt integrating into a model that we're not necessarily exposed to in school and taking your training as a generalist and integrating that into the medical model. What are your thoughts on that?
For me, I think it has been pretty challenging. We do see a lot of patients, I think, where Dr. Martin was talking about, where they really just want medication. They really think that they are here to see a physician. They're here to talk about medication and to see what they can trial and what they can taper off of. And so when you are a behavioral health consultant coming in, it kind of throws them off. And then when you start introducing just different techniques, they're like, oh, no, I was here for a medication. And so it's almost like we have to almost get them on our side and kind of see and get them introduced to it. And then once they see it, they do see that it works. They do see that these techniques work. But it's been very interesting trying to just going in and letting the patients know, kind of introducing them to the model, not really just the clinic staff.
Mm-hmm.
I'd like to kind of just piggyback off of the things Jennifer said. It is kind of a challenge that when the behavioral health consultant, we kind of come in, I've had clients that kind of resist to the change, like, oh my goodness, why is she here? I don't need anything related to behavioral health. However, once we, build rapport and get things kind of flowing and going, they're like, okay, I see where I can change and not have to rely solely on the medication. So it for me personally, it was kind of a challenge once I started getting in there and kind of getting my feet wet and seeing what's going on. And as far as the resistive change from some of the patients. But like I said, once the rapport building is going and they're like, okay, I think I can do this. I don't have to solely rely on the medication. So I think it's been good for me too.
Point. Yeah, that's what I wrote down too, and I'll tell you that's my thoughts about the model too. Is like it's a unique thing when you're in a traditional mental health setting. I won't say they always want to be there, but at least these patients know that they're coming in to talk about their mental health, right? You guys are seeing patients that came into expecting to talk about their blood pressure or talk about their flu symptoms and were universally screened and identified as needing some help with some other things or their chronic conditions. So you're absolutely right. There is a little bit on the front end, a little bit of a tug of war sometimes of, well, I'm managing with medication or I'm managing it this way, and change is really hard, right? Like that's the whole thing is changing our behavior is really difficult, and that's why we have to be involved in the medical system anyways, because we've got some things that we've got to work on, right? So I kudos to you guys, because it does take patience, it does take empathy to meet with these patients along with knowing your things clinically. Go ahead, Kim.
Oh, I was just going to add, I think these are such important points that you're pointing out. And I think that this is why, in my opinion, the team-based model is so important, because we know that that patient already has rapport established with their primary care provider in that team. And so if we could do that warm handoff and introduce this, this intern or this behavioral health consultant as part of my team who helps me work on stress or who helps me work with patients who are struggling with sleep, we can see that those patients all of a sudden start to see the association of, you know, Gabby with Dr. Smith. And so I think that that's where we start to see that bridge and why it's so important for us in the beginning to get that information. And I know I'm smiling looking over at the screen at Dr. Martin because I know that she has really done a great job with that introduction to patients. And, we know she sometimes is referring, 7, 8, 9, 10 people a day to our students, which is exciting. I don't know if you want to add about that introduction or warm handoff and what you have found that helps that be successful.
Actually, yes, I will. And poor Renee, yeah, so I always think that there's a much greater success whenever you can walk down the hall and introduce somebody. And we learned that in the hospitals as far as, that you talk people up. You'd say, oh, you're getting ready to go upstairs and they'll take really good care of you up there. You know what I mean? We learned that in the hospitals, but it's really different whenever you can walk down the hall and you can go get a real live person, hand introduction, say, hey, is it okay if I share with Renee a little bit about what you and I've been talking about as far as what you kind of expressed you'd like to learn about? And so being able to do that, I think it's just like the same thing if you're meeting people by email versus whether you get introduced to somebody out at dinner, right? And somebody says, oh, hey, let me take you over here and introduce you, and you get to shake hands or you get to see people face to face. I think it's just a different process and it's a comfort for the patients. And time again, I've heard them say, oh, I don't know as though I really have time. You can just call me later, right? And then that's part of that avoidance. Um, but when I can go down or I can say, hey, Renee, could you come in, down the hall here and sit with them for a minute and do that warm introduction? Then even if it's only just a 5, 10, 15-minute starter, right? We have much greater patient engagement because it's not so terrifying, right? They've actually met somebody. They feel like that it matters, that they matter. And I think time and time again, while patients will sometimes be avoidant, when they know that people will take the time to sit across from them, to empower them, to teach them, and to work on their process about them, very patient centered, it, in my mind, it makes all the difference in the world as far as follow up and engagement and care.
Thank you.
I agree. Yeah. Yeah, and I think that's a great way to segue into one of our last questions. We got a few more minutes here, and then we're going to transition to audience questions if they have any. Is I would love to hear from any of the students if they have a particularly meaningful interaction or story with a teammate or with a patient that they saw that just sticks in their brain and really I think shows the spirit of the model and the work that you guys are doing. Does anybody have any of those to share?
I'll definitely hop on that one. So we've had actually multiple patients who have come in for like maybe a physical health appointment or just a general care checkup, and sometimes even just like a medication refill. And then it's like, oh, I have a high PHQ score, a high like GAD-7 score, and then they're like, oh, hey, Renee, can you come over here and talk to them? And so then I talk to them. Then I realize that they need a little bit more help in different areas. And we're just able, like, especially in River Valley Medical Wellness, it's like you can just go down the hallway to a different room as well and be like, hey, I have this other person who can help you out there. And I've seen so many patients improve significantly just because of having that support, having people there for you. And even those patients, even though I refer them to other people, I still stay in contact with them. I still check up with them and I'm like, hey, how are you doing? What are some areas that we can kind of work with? And so that's really been like I don't have a specific interaction. It's just kind of like general interactions because it's been multiple of like the same experiences, really. So,
Thank you for sharing, Misty.
Yeah, I have was actually, and this kind of speaks also to the importance of advocating, letting them know, even though they know, but you're still in the huddle, you're still every morning being like, hey, hey, remember me? Hey, remember me? Because I was standing there and a lady came through to see the provider, and the provider came out to talk to the receptionist and was talking about the needs that she has. And I was like, I'd be happy to help her. And she was like, oh, okay. So I went in there, I talked to her, and she became a client. Like that first time, she just kind of unloaded. And when I went back to the provider, she was like, oh, I had no idea, that all of these things were happening. And so it was kind of like the aha moment for me, for her, for the clinic. And it was kind of like, like you kind of get to finally show off your skills and what you can do. And really she benefited from it. So that was my moment.
Those are such good examples of showing like the true meaning of team-based care, right? We know that our providers are the quarterback of the team, right? They are helping guide these patients as far as their treatment, but it truly takes an entire team all the way from reception to the provider and everybody in between to get what these patients need, right? And you both being able to advocate for these patients and taking the time and saying, I can help with that, or I can figure out who can help with that is so meaningful, right? I appreciate you guys sharing your experiences today, and I know when you're in the thick of it, it can you kind of lose the thought of like kind of the bigger story. But I do want to point out that this is a particularly challenging internship placement. It's a pretty heavy clinical placement, and then there you also had the opportunity for some macro program building as well, and we do expect that out of you, as well as seeing the patients and also doing some program building there. So I just want to give kudos again on they're sharing really sweet stories, and it may sound a little bit easy, but they are working their butts off and they are truly seeing the patients that need it in our Arkansas community. So just really appreciate the work that you guys are doing and that you'll go on to do when you graduate in May. So super close. Very proud of you guys.
Real quickly, I would love to give a shout out, and Tucker and Dr. Martin have already touched on this, but the boot camp and our supervision, like you guys, I mean, that's a lot of information in 2 days for the boot camp, and we go away with our eyes glazed, and it starts to sink in, like when we get in there. But you guys really do equip us. There's never been a time that I need to reach out that one of you have not been available. And you guys really are the core of this program and very much appreciated. So thank you and now listen, I'm like, I don't want to be a general therapist. Like this is my jam now, and I hear that similar with the other one. So kudos to you guys and thank you.
Thank you, Misty. That's very sweet. And I do want to add on with Misty is we've had several students hired in this model. I was counting it up while we were talking. We have 5 students that have either worked in this currently in the BHI model across the state, or they've been offered jobs in this position too. And that's part of the sustainability we want to see, right? Like we want to train you in these. We want you to have a great educational experience, but we want you to feel prepared to go out and see your patients and do what you would want to do with your social work career. And we're very happy to say that we've had at least one student from every cohort hired into this model across the state. So
Yeah,
hand
and
it
we
back to
could
you.
add, thank you, Caitlin. Yeah, and I just want to add, sometimes students have received offers, but for one reason or another, it didn't work out. So we've had a really positive response. And, we couldn't do it without our partner sites. And we really couldn't do it without, looking at the time, without our partners. We just want to say thank you to Blue Cross Blue Shield for believing in this program, for supporting it for the past several years. Without you all, we wouldn't be able to hear from primary care sites and from students how effective this is. We're now planting the seeds. We could see the seeds are growing and growing across Arkansas. We now have prior students who have been hired and are supervising on site, so we're able to expand sites. We want to also give a shout out to UALR. UALR has been truly amazing. Letitia Young tirelessly recruits students and goes through this matchmaking process every year. And Dr. Lindsay Ruhr, she's been amazing. She's served as the project director for this side of the project. Chris Rule, Kat, Ruth Fissel, who's been the field liaison, provided the supervision from the university, and we couldn't thank you guys enough. And I am just so proud to say we see this growing now in different areas across Arkansas. Please know this fall we will be placing 8 students, and so we are expanding the program, and we will be expanding in, excuse me, into the OB area. And so we'll be looking to place students in clinics who provide maternal health services. So know that that is coming this fall. If you are working in a primary care setting and here today listening to this and you're interested, um, in having a student, we will be looking for sites, and we will be placing 8 students in August. And so thank you all for your time. Thank you again to Blue Cross Blue Shield, the Blue and You Foundation, and all of the sites that have participated, and all the hard work. This is teamwork, and it takes all of us working together to spread BHI across Arkansas. Thank you, and I hope you have a wonderful week.